Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering psych, and to be more specific, I'm going to be going over conduct disorder. Now, before we get started, as always, I'm going to ask you to please support me and this channel by liking this video and subscribing to my channel if you haven't done so already. Please don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. And on Sunday, October 30th, 1 p.m. Eastern Standard Time, I'm going to have a free YouTube live event where I'm going to be going over priority and delegation and NCLEX type questions. And I'm going to be covering, providing some information on the new generation NCLEX style questions that will be coming up April of next year. So be sure to look out for that. Or if you know anybody that's studying for NCLEX, please let them know about this live review that I'm going to have on Sunday, October 30th, 1 p.m. Eastern Standard Time. Again, it's going to be on YouTube Live. All right, guys, so let's get started. Conduct disorder. Look at what it says. It says conduct disorder is a persistent. When you see that word persistent, that means it keeps going despite interventions. It's not stopping, okay? So conduct disorder is a persistent pattern of behavior in which the rights of others are violated and societal norms or rules are disregarded. And what I put up here, it's important for you guys to understand. I wrote that it's more severe. It includes aggression towards people and things such as property, animals, okay? So conduct disorder is much worse than, I'll give you oppositional defiance disorder. Matter of fact, I got to do a video on that. So I can kind of compare and contrast the two because you do have to know the differences. But if we're talking about oppositional defiance disorder and conduct disorder is worse. It's more severe. It's more aggressive. Okay. The behavior is usually abnormally aggressive, and it can frequently lead to destruction of property or physical injury. Persons with this disorder initiate physical fights and bullying, and they may steal or use weapons to intimidate or hurt others. Coercion, trying to force someone to do something. Coercion into an activity against another's will, including sexual activity, is characteristic of this disorder. I circle that word to characteristic. Why? When you're studying and you see words such as characteristic or something that says perfect example or what do I see a lot in the textbooks? Not cornerstone, but cornerstone, something else. It'll come to me. But when you see something like characteristic, that lets you know when you see this, you really need to be thinking of this. So letting you know that that type of person that will force someone into an activity that they don't want to do, such as sexual activity, that is characteristic of conduct disorder. Okay. These behaviors are enduring patterns, and it continues over a period of 6 months and beyond. They tend to skip class, disrupt school when they do go to school. They tend to fail, be expelled from school, or just drop out. Complications associated with conduct disorder include juvenile delinquency. They just don't go to school. Drug and alcohol abuse, drug and alcohol dependency, juvenile court involvement. So we tend to see them getting arrested a lot and, going before the judge a lot, right? People with conduct disorder crave excitement, and they don't worry as much about the consequences as others do. What does that tell us? That tells us that excuse me, guys, you hear my voice is weird. I'm just getting my voice back. I'm been sick, but I'm feeling better. When you see they crave excitement, they don't worry about consequences, that tells us that this patient's what? They're impulsive. If they want to do something that makes them feel good, they're going to do it. They don't think about the consequences down the road. Childhood onset conduct disorder occurs before the age of 10 and occurs mostly in males. So we see this in children before 10. We start seeing these clinical manifestations before the age of 10, and we see this more in boys. They're physically aggressive. They have poor peer relationships. Of course, they're going to have poor peer relationships because they're bullies and they try to force their peers into doing things that they don't want to do. They show little concerns for others. They have a lack of guilt or remorse. They will do something to another child and then blame the child and say, well, they deserved it because they should have been strong enough to stand up to me. They tend to interpret others' intentions as hostile and believe their aggressive responses are justified. The minute you go against them, the minute you don't want to go along with their plan, you're seen as the enemy. And anything that they do to you in response to that, you deserved it. That's how they think. Violent children also often display antisocial reasoning, such as he deserved it, when rationalizing their aggressive behaviors. Let's stop for a minute, because when you guys see antisocial, you tend, as students, you think antisocial like, oh, I don't like being around people. No, let me tell you something. When we're speaking about antisocial behaviors in the clinical setting, those patients who are antisocial actually love being around people. Why? Because they're con artists. They love to manipulate people. So they will be whoever they want you to be for that time being, so they can get whatever it is that they want out of you, whether it's sex, whether it's money, whether it's drugs. Okay. So I know in layman's term, when we talk about antisocial personality, we tend to think, okay, they're people who are antisocial. They don't like to be around other people. But when we're talking clinically, medically speaking, people with antisocial personality, they love being around people. Why? Because that's the only way they can manipulate people. They're con artists, and they know how to change their personality into whoever it is that they're trying to con to get whatever it is that they want to get. So we tend to see those antisocial traits in the patient with conduct disorder. Children with childhood onset conduct disorder attempt to project a strong image, but they actually have a low self-esteem. They have limited frustration tolerance. That's why the minute you don't go with their plan, you're the enemy. They cannot tolerate any frustration. They can't tolerate any situation where they are not getting their way. They have limited frustration tolerance, irritability, and temper outbursts. These are the hallmarks of this disorder. I circled that word hallmark. When you see that word hallmark, that's another, I think that's the word I was looking for. That's another word for saying characteristic. When you see these behaviors, this is what you need to be thinking of. Okay? In adolescent onset conduct disorder, no clinically significant symptoms are present before the age of 10. So in childhood, we see those clinical manifestations before the age of 10, but at adolescent onset, we really don't see it before the age of 10, okay? Again, males are more likely to fight, steal, vandalize, and have school discipline problems. Let me tell you what type of problems the girls tend to have if they have conduct disorder. They tend to lie, be truant, not go to school, run away, abuse substances, and engage in sexual promiscuity. The subset of people with conduct disorders referred to by the especially dangerous terms of callous and unemotional. They just don't care. They don't exert or exhibit any feelings or compassion at all. Callousness is characterized by a lack of empathy and being unconcerned about the feelings of others. Expression of guilt is absent, except, look at this, except when facing punishment. So when they're expressing guilt, they're really not feeling guilty. They just know that they're about to be in trouble, right? So that's when you see those expression of guilt, but it's not true guilt that they feel. They just don't want to be punished. School and family obligations are unimportant to the affected individual. We keep seeing this word callousness, guys. Callousness is a predictor of future antisocial personality disorder in adults. When we see that callousness in the child, that lack of empathy, that is a future predictor that as an adult, they're going to have antisocial personality disorder. Remember, I told you those patients with antisocial personality disorder, they are con men. Unemotional traits include a shallow, unexpressive, and superficial affect. So let's look at the DSM-5 criteria for being diagnosed with conduct disorder. At least 3 of the following 15 criteria in the past year, in the past 12 months, from any of the following categories with at least one criterion present in the past 6 months. So this is saying a handful. Patient has to have at least 3 out of the 15 criteria. It has to be within the past year, and from any of the following categories with at least one in the past 6 months. So let's look at that list. Aggression to people and animals. I'm not going to read all of these to you guys. You can pause to read on your own. Okay, make sure you know them. Next, destruction of property, deceitfulness or theft, serious violation of rules, let's go over the treatment approaches. Psychosocial interventions. Conduct disorder is treated similarly to oppositional defiant disorder. Again, guys, I'm going to make sure I make a video for you guys so you can be able to tell the difference between the two. Treatment methods are selected based on the behaviors being targeted, whether, it's truancy, whether it's substance abuse, whether it's lying, whether it's stealing, whatever, that behavior is. The most successful treatments require parental participation. I don't know why I didn't circle this, but that word most should say something to you. And that's important, it's a priority. The most successful treatments, it requires the parents to be involved. Psychological treatment. Medications for conduct disorder are directed at problematic behaviors such as aggression, impulsivity, hyperactivity, and mood symptoms. There are 5 classes of medications that are used for children and adolescents with conduct disorders. Professor D, do I have to know those 5 classes? Of course you do. Don't shoot the messenger. What are they? Antidepressants. Because remember, as much as they show that big bravado and, that big ego, realistically, they think very little of themselves. They have very low self-esteem. So why antidepressant? Well, let's talk about this. What is depression? Depression is anger, hostility, resentment turned towards self. I'm not worthy, right? So antidepressants, mood stabilizers, stimulants, antipsychotics, anticonvulsants, and adrenergic medications. All of these have shown some efficacy for the patient with conduct disorder. Now, these 2 meds, the Abilify and Risperdal, they're 2 second-generation antipsychotics, and they have shown some efficacy as well. And guys, that is basically your conduct disorder in a nutshell. Please let me know what you thought about this video. Let me know what you'd like to see me cover more extensively. I promise soon I'm going to cover a video for you for oppositional defiant disorder. Please don't forget, October 30th, 1 p.m. Eastern Standard Time, free YouTube NCLEX review on YouTube Live. I have audio lessons available for you on my website, nexusnursinginstitute.com. Thank you so much for watching this video, and you guys catch me on the next video.